Today we had a press conference. Hi, I'm Rebecca Brown with my daily coronavirus series. Almost every hospital and medical center in America is going to be overwhelmed. Our county has daily meetings, and every day we get important information that affects our community.
Rebecca, go ahead.
Hi there, I've got this question. This is for Supervisor Hart, Homer. I'd like to know, what are the pipelines to get more ventilators, and is the county pursuing those?
I think actually perhaps Dr. Delrenoso is the best person to answer that.
Yes, so the county has access to ventilators that we have dispersed to needed healthcare partners, and we are actually assessing the county's need and have initiated the conversation with the state for extras.
Well, that's great. I would be worried, of course, that LA and San Francisco would probably get the first, pick of that. We're a small community. And looking at the numbers, if New York is asking for 30,000 ventilators, that would be one ventilator for every 666 person in a population. Our county would have 445,000 people in the population. That would mean that if we were to follow the New York example, we would need 668 ventilators throughout our county, which sounds like a very high number. And New York could be the worst case scenario because the social distancing could be terrible over there. And if we follow it here in the very best case, though, it seems to me that even if it's not around 700 ventilators we would need, it would certainly be a few hundred ventilators. And if our only pipeline is Governor Newsom in the state of California, I think maybe we have a wonderful population of very well-connected people that could call on industry and other things to provide what we need if we are shut down by the governor and getting what we need from governmental sources. And so my next question would be, what channels, or Supervisor Hart, what would you think or offer to our population of helping you, because I'm sure everybody there is very overwhelmed with this situation, and there's a lot of people may not be working now that would like to help. What kind of things can you tell us to do to help you and support you?
Well, thank you for that question. If folks have resources that they would like to assist us with, we are ready, willing, and able to take those. The best number to call to make that connection is our call center number, which is 833-688-5551. Community members, as I mentioned earlier, have been very generous donating supplies. We have, the public health department has a very sophisticated system that they've developed for allocating those supplies to fairly allocate them to various communities in the county. The state of California also has a very robust system for fairly apportioning supplies that are available at the state level to local governments. And we are proceeding with those plans in place.
Maybe your community has the same types of meetings and you can tune in on their website or on your television. Ours are both on the website and television in Santa Barbara, California. Today is March 24th, 2020. Even if you're not in New York and have density like that, your city probably isn't going to be prepared. I live in Santa Barbara, California, which is a city about 90,000 population. You can think about your city and how much population your city has. And anywhere in the world, this example might fit your city on some magnitude. You can do the math. Probably every hospital in America will have a surge of patients with COVID-19. Using New York as a pinnacle of probably the worst case scenario, they have 20 million population. Governor Cuomo has asked for 30,000 ventilators, which is one ventilator for every 666 people. Santa Barbara County has a population of 445,000 people. You can do the math to see how this equation is going to work with your own. So divide 666 by your county or your city's population. We share our hospitals within our home county, so I'm going to use the county numbers, not a population number of about 90,000 in Santa Barbara. So our county's population of 445,000 divided by 666 equals a need for 668 ventilators. Equals our county's need of 668 ventilators if our situation were to be as bad as New York City's. We only have 62 ventilators in our county. Surely we're going to need more than 62, and maybe not as many as 668 for the worst case scenario like New York City is facing. But certainly we will need hundreds of ventilators. Santa Barbara is a small little city in the scope of California. Certainly, Governor Newsom is going to advocate for ventilators for our state. Santa Barbara likely is going to get lost because it's a small city. Nobody in our county government, city government, or public health officials ever saw this day coming. And maybe not in your municipality either. How is the greatest of all governors going to divvy up what he can wrangle out of our federal government or any other place he can get those ventilators? That's likely going to be a lot of difficulty and trouble. And is he really going to be able to secure any for our little town of Santa Barbara, California, and our county? Maybe not. So therefore, we as citizens need to rise to the occasion and help out. Every city government, hospital, and public health department is racing for this. They are overwhelmed, I am sure. The dam is broken, and we in the valley need to come up and help repair that dam before our health systems all crash. What can a citizen do? What can you do? What can I do? Many of us are out of work and have less to do because of the economic results of this disaster. Therefore, we might have some time and we might feel more powerful by doing some action to help. There are lots of ways to help. There are leaders in our community. Many of you watching this are leaders. There are CEOs out there. There are people of influence, people in medical sales. There are all kinds of people watching this video right now with an amazing skill set. Maybe you're in sales in your last job. Maybe you know how to get on the phone and make phone calls to see, with the contacts you have, what types of supplies you can secure for your municipality. Maybe you're in computer science and you make websites. Maybe you can make one for your community for people to band together and throw their resources together on that website. You might be a computer software kid. Those skills might be necessary to have coding so that people have a place to go and register what skills they have so they can march forward in a fast way. We need to rise up and work now. We are behind the 8 ball. There are CEOs watching this. There are entertainers watching this. There are people connected to all kinds of people that might have inroads to, maybe some factory down the road could do something. Maybe you're an engineer and you can make the pattern for your community to cut and make the protective masks that go over the cloth masks if we can't get the N95s fast enough. Hospitals around the country are asking for homemade masks. Join that sewing group, or cut the fabric, or go pick up the fabric and deliver it to the sewers. What can you do to help? Now is the time. Now is the time because we are behind that 8 ball. It is rolling down fast at us. Let's empower ourselves now to help. I also want to mention you probably want to organize in a way that's unobtrusive to your municipality, to your government, and to your public health system. For them to take all these questions and emails and demands, well, I want to do this and I want to do that, and can you tell us what's happening here? They are overwhelmed for certain everywhere. Form your groups, go on your social media, go on Facebook, Twitter, Instagram, LinkedIn, find your groups, be part of a group, make a small group. Small groups band together. You don't have to have the only sewing group making masks in your city. You can be one of many. The same goes with making protective covering. You can make protective covering according to CDC guidelines out of hefty trash bags. These are non-gender activities. Girls and guys can make protective outerwear for our nurses and doctors and medical assistants. Even if your hospital is supplied today, think down the road. Think down, let's say in 2 months, 1 month, 2 weeks. There isn't any left. They're going to be thankful they have the stockpile of what you delivered maybe ahead of time. Maybe today they're not accepting masks or outer protective gear, but anticipate that one day they might need it. Best case scenario, they'll never need it because social distancing will work. Likely, the social distancing will only work so much. So although your community, like mine, may not need 668 ventilators, it might need 300. And we only would ever have maybe 200. We have to help our doctors and medical personnel best we can to try to save as many lives as possible. Let's start this now. I'm Rebecca Brand. Subscribe to my channel. Ring the bell above to get notified of my next video. I'm producing these dailies. Please comment below and tell me your thoughts on this video and what things and ideas you have to help your community so we can share this worldwide with other communities, other people, so that we all are powerful in conquering this horrible coronavirus that's attacked our whole world. Thanks for watching, and I'm excited to read the comments of how you're going to help your community, because I know you will. Bye.